Thank you very much, Sazi, for that. And yeah, remarkable work. I'm also going to then hand over to Linda Chamane, that is from Maritzburg. So today you'll hear we're focusing a bit more on KZN. We are hoping to travel a little bit through the country as we continue. But yeah, we would love to hear from Linda Chamane for the work that's being done there and all the information there. Thanks, Linda.
Can everybody hear me?
We can hear you, yes.
Yes. So I have a bit of a problem with my laptop, so I am zooming via my mobile phone. So basically, I'll be focusing on support groups, focusing on the KZN trans perspective. So basically, how did we get here? So we often find we often experience exclusion as we navigate through society because of the discrimination we face based on our gender identity, sexual orientation, gender expression, and sex characteristics. So basically, what I'm going to focus on is centered around changing one's disadvantages into advantages. So I would like to allude to like my own experience. So basically, when I experienced exclusion and discrimination and a lot of abuse, from my home setting, um, I started thinking as to like all the darkness that I had experienced that, I don't want any other person to have the same experience as I did. That is how I started trying to find ways of how I can be able to support my other fellow trans siblings. Because like we find that most of the time, like in our own native languages, we do not have concept to identify who we are as trans bodies. Is often centered around, derogatory terms such as isitabane, which is often a derogatory term which they use as an umbrella for people who are LGBTQI plus. So basically, focusing around that, I'd like to also allude to the fact that wellness is different for everyone, and we should take into account that it's not a one size fit all kind of process. So it is important for a certain individual or maybe like a healthcare practitioner when they're trying to find ways of supporting a trans individual to understand them from their own frame of reference, instead of using, like the same manual for each and every individual. So basically, as carried on through my process of affirmation, I often use the word affirmation because for me, it didn't feel like a transition. It felt like a way of affirming myself as a woman, as a girl that, I was meant to be. As I explained, the fact that, as I was growing up, we didn't have a concept to identify who we are. So when we found a refuge through the KZN support group facilitated by Chris McLaughlin, that's how we started, being more well informed as to who we are. And I believe they, went like they went like they did so much, not just as a psychotherapist or a clinical psychologist. They also acted as a as a mentor, and finding support from Chris McLaughlin also helped because that's how we started being introduced to things like gender affirming healthcare and the mental health part of it. And it's also very important for one to position themselves, especially when they need support with individuals that they share like a common goal, because you don't have to explain yourself to those individuals because you share the same identity, even though your experiences might differ. But that was sort of like a very important element to it. I think another Another element that we often forget is centered around family. I think we often forget that sometimes, as much as we are going through like the process of affirming ourselves, we also need to create structures, in finding ways of supporting parents of trans kids and also their partners, and also sensitizing the community, because I mean they are also going through that process, so they need to be capacitated with the knowledge and education to be able to understand, trans identities, what they are, and also using values, so that they can, be able to understand better, such as, the values of Ubuntu, that nobody lives in isolation. I am because you are. So we also need to start channeling ourselves and finding ways of making that connection, because the way we identify basically for now it's centered around westernized terms. So you find that your gogo wouldn't understand, because what exactly is going on, because you are, that word does not exist in your language. So we also need to find some common ground and be able to advocate and doing some sensitization work around that. So what we've started doing as well is also, as I was mentioning, parents, because of, we are much older. So you're finding that most younger trans individuals are coming out early. So you find that parents would, approach us and, trying to find out what is going on. So it's always um, good for, having that kind of visibility. When you talk about activism, we often think of people standing in front of everyone and, in front of the crowd, and forgetting that each and every individual is an activist, in their own right. And by them living in that society and navigating around that society, makes them the role model of that, the next individual, because they start understanding, as you find some people approach you, what is going on, and then you'd explain, like your situation, and also finding and also creating support structures, which is what we've been doing to parents of younger trans individuals. So we also need there's like a lot of work that is still needed to be done in creating our own concepts, as I explained earlier, in us being able to identify who we are in our own African languages. And another element that is very interesting from the KZN support group is that of sharing information and resources. So basically, as Chris and Sazi alluded earlier, and the fact that, uh, as we are navigating through the healthcare system, and accessing gender affirming healthcare, like many of us, would have like booklets, because we have resources. We've been capacitated, and well informed as to, what trans health is about, what gender affirming healthcare is about. So just going there and accessing gender affirming healthcare, um, one would find themselves training like the very, an endocrinologist or a doctor or a nurse, and then they would start asking questions. And I mean, by the time you are out, you have shared your resources, and that individual would go, carry on and, educate the next individual. And by so doing, you also creating those linkages, even like when you're going through to that certain clinic, because like what some of us would do is add on the database that individual, if especially if they are trans affirming, you'd add them on the database, and then should they be the next trans individual that needs support, then you know that at that certain clinic there's a very trans friendly professional, a nurse, for example. So capacity building is very important. So moving on, and so how does one become an ally and creating a safe and affirming space for trans individuals? It is important, like as I was mentioning earlier, that even if you don't have the information, it is important to not to make assumptions and to ask questions, but in a respectful manner. And you are demonstrating that acceptance through your physical, mental attitude and behavior. So sometimes you find that what you say might contradict your non-verbal communication. So it is very important to take into account that, and be aware of of those facets as well. So by the time when a trans individual enters, that certain clinic or institution, it is important to, ask questions. Ask questions like, for example, which pronouns do they like to be addressed by, and their correct names, and things like, gender, and your titles. Because now you find that a lot of intake forms are centered around the gender binary. So it's either you're a male or female, you're a woman or a man, and basically what exists outside of that in most institutions doesn't really exist. So now it is in us, trying to find ways of working with your departments so that the intake forms can be more inclusive. So basically, that is like one of the elements that I did when I focused on when I started in doing my internship at a local organization. Um, I checked if the intake forms were, affirming and inclusive. So another element would be when you look at your policies, are they inclusive? Like your toilets, are they gender neutral? Your residences, your schools, institutions, are they conducive and affirming to trans individuals? Um, so basically, another element when you are you're providing your services is to the idea is not to change the individual in terms of how they identify themselves, but instead you create conditions in which they can explore themselves and decide if there are elements that they need, to change. You need to understand that every trans individual is an expert of their own reality. So when you work together, you find common ground and you learn a lot from them. As Chris was explaining, like in terms of reports that they write collaboratively with the client. So one needs to look at those elements as well, um, and basically not threaten the self structure of that individual and ideas of themselves and who they perceive themselves to be. So yeah, another element that now we are focusing on is accountability. So I remember Sazi and I had a conversation when I was in Durban as to holding people accountable. We are finding a lot of organizations and institutions treating trans individuals as guinea pigs. You find that when you look at their structures in terms of employment, that you wouldn't find like trans individuals being employed, and we know that there's like a very high rate of unemployment in our community. So what we've been doing as a group as well is calling those certain individuals into account, and we need names. We want to know because we need to create that access to employment. It is important. It is critical. We need to meet each other halfway in the process, and I believe that what VIT RHI has been doing, for example, like I think there was a discussion around that, and I've seen there's a lot of trans individuals that are employed within the VIT RHI. So I believe that other organizations should also learn from that as well, and try to find ways and best practices. So yeah, that was what I wanted to share. Thank you very much.